Awesome. Thank you all for joining today. I know more people will come along, and a lot of people will be watching this talk on my YouTube channel, which will be great. But my name is Melissa Tompkins Lewis, and I am the owner of South Coast Veterinary Management Solutions. And I'm very, very excited today to be presenting, or not me presenting, I'm going to have Theresa present. I'm going to introduce Theresa in just a moment, and she's going to present today on my YouTube channel as well as live on my live webinar. The second Thursday of every month is my planned date. We're going to continue that throughout the year, so hopefully y'all can sign in at another time. So I would love to say, if you're not watching live and you're watching on the channel, you already know that the channel is at South Coast Veterinary Manage 263. If you're not watching it and you want to rewatch it on there, you're welcome to go there as well. I will also send a recording to everybody who did register for the event, and Theresa has sent me a copy of her slides, so I can send out a PDF of the slides to everybody who registered. So hopefully you'll get to enjoy that. So this morning, I have the privilege of introducing Theresa Cosper-Roberts, who is an awesome, amazing person who I met last year and have had the benefit of presenting with now a few times. And it's been a great kind of year, actually, it's been over a year. We spoke together last year in June, and it's in Minneapolis. So it was awesome. So lovely, excited to have her talk today. So please, Theresa, go ahead and take it away. And one quick question, if you have questions, please throw them in the chat and she'll be able to answer them, okay? So Theresa, please go ahead.
Well, thank you for having me, and we will go ahead and get started. So, language barriers with clients with limited English proficiency. They can be a source of significant frustration for us, but a lot of us don't realize how frustrating those situations are for the clients and how common that's actually becoming. Let's see if I can actually push the right button to advance the slides this time. Here we go. So, over 25 million people in the United States have limited English proficiency. So that is 8 to 9% of the population that's ages 5 and older, with California, Texas, New York, and areas like that having the highest populations. And these language barriers significantly impact our outcomes with patients, because if we can't communicate with owners, they can't provide the best care possible for their pets. So practices that can efficiently and effectively serve those clients have an opportunity to not only provide better care and provide standard of care, but significantly expand their client base tremendously. If you're the only practice in the area that caters to that base, that's a whole bunch of clients that you have that other people don't. So why do we care about language barriers? So they cause a significant impact for our clients because they limit what we can do with them. It decreases the client's access to care. It makes them frustrated and dissatisfied. It frustrates your staff, and it can potentially lead to burnout because your staff members can see that these clients want to do the best, but they physically can't communicate in order to convey everything that your doctor wants done. It also leads to decreased compliance with treatment recommendations, not because the owners are non-compliant, but because they just don't understand what you're telling them to do. And this affects the practice's entire workflow. It affects our appointment scheduling and the time that it takes for us to schedule appointments and when we can have those appointments scheduled so that there's someone who's there that can translate. It affects the accuracy of our history taking and client communication. It affects how well we explain our treatments and options. And the big one for me is cost. And it affects our discharges as well. So we need to understand what those clients are going through, because it's really easy to say how it affects us, but we need to understand what it's like for them. Not being able to understand what someone's saying is a really, really, really big deal. So what is limited English proficiency? So the Census Bureau defines that simply as someone who speaks English less than very well. So that's someone who doesn't have English as their primary language or their native language, or they have a limited ability to read, write, speak, or understand English. It is not the same as being someone who doesn't speak English, because proficiency exists on a spectrum. Anyone who's ever taken intro to whatever language in high school or elementary school can tell you, yes, technically you speak Spanish. You mostly speak curse words, but you speak Spanish. That is not the same as someone who can read and write in that language and who can speak fluently enough to translate complex medical terminology. So proficiency and whether or not someone speaks English is going to be based primarily on the context. Yes, I can speak Spanish, I can speak German, I can speak this, I can speak that. Can I speak that well enough to tell someone that their dog has a cruciate injury and explain all of the different medications and all of the surgical outcomes? And something else that's really interesting is that English proficiency is greatly affected by stress, illness, and emotion. So, thinking about when you're bringing your pet to the vet, especially if it's an emergency hospital or specialty hospital, feelings are heightened, emotions are heightened, you're thinking about cost, you're worried about them, that is going to drastically affect that person's ability to communicate with you effectively. And sorry in advance, guys, if you hear birds chirping. I have two lovebirds who are being quiet right now, but right when I'm saying something important, they're going to start chirping. So sorry in advance. So, what are some common challenges for those clients with limited English proficiency? The biggest one is that they have trouble following medication instructions. So I actually experienced this at my first real job as a technician. I was working overnight at an ER, and I was the only person there who spoke Spanish. And we had clients come in with a puppy who was laterally recumbent. The dog had just had some sort of major orthopedic surgery a few weeks prior and just looked absolutely terrible. And no one could figure out what was going on. The owner didn't have anyone who could translate for them. So I eventually said, hey, I speak Spanish, and got brought to the room. And I sat there and listened to this woman and listened to everything that she had to say. And we went through all of the discharge documents, and we went through all of the summaries, and no one could figure out what was going on until I actually sat down and talked to her. And we started discussing the anti-inflammatory that she was supposed to be giving her pet. And the instructions said to give the dog one tablet once a day. But once is once in Spanish, which is 11. And this dog, for some reason, had a full, like, huge bottle of Remedil. And this owner, because of the language barrier and because of her limited English proficiency, was giving this dog 11 tablets a day for at least a week. So that one little thing that we don't even think about had a tremendous impact for that patient. And that patient actually ended up needing a therapeutic plasma exchange and had to translate to a university. And that bill was tens upon thousands of dollars. So something really simple or something benign like that can have a really profound impact on those clients. And that's just one example of a common challenge for them. It's difficult because they're uncomfortable or embarrassed by their language limitations. They feel like they're being judged or dismissed. The barriers can also keep them from asking questions or expressing concerns, or even explaining what their patient's symptoms are, or what the history is. But most importantly, in addition to having trouble following medication instructions, it also makes it challenging for them to understand your diagnostic findings and your treatment options that are available to them in order to provide the best care for their pets. So, what's it like when those clients come into the hospital? Because this is a whole experience. So before they even get to the practice, and I experienced this firsthand. I was doing a semester abroad in a country where I did not speak a lick of that language. And my little roommate or housemate had a coconut dog, is what we called them, one of the island dogs. And we had to find a vet for them. And the first thing that we had to do was go online, find websites that were in our language or that could be translated into English, and try and find someone. And then we had to try and call and schedule an appointment, and then try to understand everything that they were saying. And during that visit, I had to fill out forms in a language that I didn't know. I had to communicate with staff members who were very nice, but we were both getting frustrated because I just had no idea what they were talking about. And this is so long ago that there was no Google Translate or anything like that. I was sitting there with my little dictionary and flipping through it and trying to say all of these different things and communicate with them. It was a nightmare, and it was taking 50 million times longer than it needed to take. Once we got into the room with the veterinary team, we couldn't really communicate what was wrong with them to the veterinarian and the staff member. And because we couldn't communicate what was wrong, they did their due diligence, but when they came back with their diagnostics and treatment recommendations, we couldn't understand what they were. And then after that visit, it was really hard to try and follow up with the medications. And they actually had to draw us out a little table and take pictures of each one of the different medicines and what they looked like and put them there. And we had to do all that in the room. But also there were concerns about us recognizing signs and complications and when we needed to bring the animal back in and how we would need to schedule follow-up care. So it's not just when you're in the room and the client's getting frustrated or you're getting frustrated. This is a huge, long experience that these clients have to deal with that affects every aspect of the care that they're getting. So, how does that impact them? So, in human healthcare, language barriers are associated with lower preventative care utilization, higher rates of misdiagnoses, increased ER visits, more medical errors, whether they're errors or adverse events, and longer hospital stays. And even though we don't have that data in our field, it has similar impacts for us. So there's poor outcomes for patients, missed appointments, not because of non-compliance, but simply because owners didn't understand what you were saying, lower compliance with recommendations, medical errors due to misunderstanding of recommendations, and delayed presentation of disease, because it took us 3 days to find a vet that we could even go to. So when it's something critical, it can take even longer, especially if you're in a community that doesn't necessarily provide all of the things that you need for those clients with limited English proficiency to really be able to reach out when needed. So I feel like I just had this slide, but we'll keep going. So these barriers can also affect their understanding of treatment recommendations, their follow through with preventative care, and their willingness to return for future care. If they don't feel comfortable with you, if they feel dismissed or undervalued, or as if they're becoming frustrated with you, think of it just like a bad date. If you have a bad experience on a date, even if what you experienced was just your perception of it, you're not going on another date with them again. So all of those things can reduce the likelihood of seeing that pet again. So we know why this is a big deal. We know how it affects us, how it affects the patients. How do we fix it? The first thing that we need to do is assess our practice's language accessibility. What are we like? What are we doing well? What do we need to improve upon? So the first thing that you need to do, look at a language needs assessment. Look at the demographics for your area. So pull census data, reach out to your city if you're in a city or in a state, look at all of the demographics, look at the percentages in different languages that are spoken there. Analyze the language that your clients currently speak. So if you don't already have it on your informed consent or your intake forms, ask the clients what their preferred language is. Even if you don't have someone there who speaks that language, you at least need to know. Ask your staff members about any barriers that they've encountered when speaking to clients. Have there been any issues? Have they had to get assistance? Have you had any clients who've called and asked for assistance or said, hablas español? Has there been any of that? If so, it needs to be documented and tracked. If you are in a community that has individuals from limited English populations or marginalized groups, talk to community organizations and community leaders to see what their experiences have been and see if anyone's catering to their needs. So once you've done that, we need to identify critical communication paths. So our points that are going to be really critical for the success of these clients in our practices, it's going to be any financial conversations, treatment option discussions, any discussions about diagnostics or our diagnoses, medication instructions, even going back to the beginning, phone calls and check-ins and scheduling appointments. Once we've seen them, discharges and home care and follow-up instructions. And in looking at all those things, we need to prioritize communication points that have the highest impact on patient safety, client understanding, financial decisions, and home care compliance. So yes, the check-in and registration process, that can be frustrating for everyone involved, but that is not as big a deal as your doctor or your credentialed technician being able to explain a diagnosis in a way that the owners can easily understand and explain the treatment options available. So we really need to hone in and focus on those highest priority or highest impact points. Melissa, any questions in the chat yet before I keep going?
No, just comments. Good ones.
Okay.
Yeah.
So we know what our practice is like. Now we need to see what we can do, what we have. We need to open the purse strings, look at the budget, look at what we have in the wheelhouse before we start spending money, because anybody who's a practice manager knows you need to look at money before you do anything else, because if a doctor sees dollar signs or a practice owner sees dollar signs without you communicating the value, you can forget it. So The first thing that we need to do is inventory our practice's existing language access resources. Do you have any bilingual staff members? And with that, do they have verified language skills? Not someone who said that they speak Spanish, and then when you actually have a Spanish speaking client, they come in the room and they're like, Me llamo Teresa. Yo boy are no, people who can actually communicate effectively in that language. Do you have any contracted interpreter services? Do you have any visual aids or pictograms or diagrams that you can use? Do you have any documents that are multilingual documents or forms? Do you have any community partnerships? Talk to your current staff members, assess their knowledge, because your staff members are a wealth of knowledge and information, and all you have to do is ask. Have any of them worked with interpreters? Are any of them from those communities? Are there any cultural communication differences that you need to know about? Or any language access tools or resources that they're already using? Especially if they are individuals from the younger generation, so Gen Zers. My kid had to show me how to do something on my computer the other day, and he's almost 9, and I was very upset because this is the same person who doesn't even know what a magazine is. But he was able to show me all of those things. So rely on them. But the big one that you want to focus on when you're evaluating your current resources and capabilities, what are the laws and ethical requirements in your area, whether those are state laws or laws with your practice act, or just general ethical things or ethical gray areas that you need to be aware of. So once we've done all of those things, once as a teacher, I have to tell you to do your homework, then we need to figure out what our priorities are. What do we want to focus on first? We want to focus on the things that are going to affect us the most. So the biggest thing for me, focus on anything that can get you sued or get licenses taken away. So we need to just look at informed consent and any legal documents, legally binding documents that people are signing. Discussions about informed consents, because it's one thing to have someone sign a document, it's another thing to have them sign a document that they can't understand, because that is equivalent to having a drunk person or a child signing a document. It is not legally defensible. Any critical care or emergency instructions, any medication dosing or administration instructions like once cada dia instead of 1 per 24 hours, any post-surgical instructions, or any financial decisions or estimates. So we're going to focus on those highest impact areas, and then we're going to start making goals. We're going to make short-term goals and long-term goals. Our short-term goals are going to be to start training staff on working with interpreters. We're going to get basic translated documents for common conditions, whether we're getting them on VIN. I think there's also a really good textbook out right now. It may be AHA. I can't remember. I think it's AHA, but there are a bunch of different resources for documents in common languages spoken in the United States. All of those things. You can also get language identification tools that are available as just apps on your cell phone. So little bitty things like that we can start doing to start making a difference. We also need to set some long-term goals too. So in that, because I am on the spectrum, so I love coming up with plans and lists and everything else, you need to have a comprehensive language access plan. So if you have someone in your practice who's really passionate about these things or wanting to make a difference or looking to move into a more administrative role, this is something that you can give them to work on. Also, if you have a staff member, usually a technician, because once again, I can say it because I'm a technician, so I'm allowed to talk about us, a really anal retentive technician who loves focusing on details, this is something to give them to do. Have them pull the data, have them do the research, have them start to develop a plan and bring you that plan. Start looking at expanded multilingual materials and resources. So talk to local law firms or universities or things of that nature and start getting documents translated into the languages that are most common in your area and start to really integrate those language services into your regular practice workflows. So we know what we need to start doing. The biggest thing is we need to communicate with those clients when we're there, and that communication needs to be effective, easy, non-frustrating communication. So there's 3 primary ways that we can communicate with clients with limited English proficiency. In-person interpretation is the most common one. It's the one that everybody thinks about. It's amazing because it's the highest quality communication. It allows for complex or lengthy discussions, and it allows you to see nonverbal cues. And that's, I'm sorry, my husband is playing off in the side in the background, trying to distract me, guys. Sorry. I'm just gonna keep looking this way and yell at him later. So the interesting thing about in-person interpretations is that they are amazing because they can pick up on so many different context things that you're not seeing in all of those nonverbal cues. Like me, I'm sure you guys can tell by now, I am a really big talker with my hands. And I always love to joke. I have a friend who is Italian. And if I ever want her to be quiet, I can just grab her hands because then she can't communicate. Yes, Mandy, I'm talking about you. But so in having that in-person communication there, you can catch all of those things. The problem with in-person interpreters is that they are very expensive. And if they are a professional interpreter, they usually require advanced scheduling. Then you have telephone interpretation. Telephone interpretation is usually available 24/7. You don't have to wait. It's usually a lot less expensive than in person, but it only works well for short interactions because they can't pick up on any verbal cues. They can't pick up on any body language. And in-person communication can be really, really hard depending on the practice that you're in. If you're a high quality, high volume spay neuter facility or a practice that is just loud because your treatment area is right next to the kennel or your exam rooms are right next to the kennel or waiting area, it may be very difficult to have those conversations and have everyone hear everything effectively. Video remote interpretation is fairly new because it combines the benefits of both in-person and telephone. So there are a lot more languages available because you can do Zoom or Teams or other remote platforms. It is more expensive than telephone interpretation, but still for the most part, less expensive than in-person interpretation. So we know we need an interpreter. We know what kind of interpreter we want to get. How do we talk to them? So communicating effectively with an interpreter can be very difficult if you don't know what you're doing. And that is coming from someone who worked for a couple years as a Spanish interpreter and translator at a law firm. If you have not communicated with an interpreter and you are not prepared for it, it's going to be frustrating for all parties involved, especially the interpreter. So before the session, if you have access to the interpreter, brief them on the case. Tell them a little bit about the case. Tell them any technical terms that may be used. So fully explain everything that you are going to talk about. So if you have a patient who has IVDD and you're going to have to do a hemilaminectomy or something like that, make sure that they are familiar with that procedure in advance. So give them handouts, give them like printables from then or anything like that so that they're familiar with it. And also talk about your goals for the conversation with the owner. If you're having a come to Jesus with an owner where it's the end of the life conversation and they need to start making decisions or just start thinking about things and maybe pursuing palliative care or hospice care, the translator or interpreter needs to know about that so that they are prepared and that they can use the correct words effectively and with the most appropriate tone and context in order to be able to communicate with that client. During the interaction, make sure that at all times you are speaking directly to the client, looking at the client, not the interpreter. The interpreter is just a vessel. When you're talking to someone on your cell phone, you're not looking at the phone. So make sure that you are treating the client the same way and being respectful. In interacting with that interpreter, use short, clear sentences and avoid medical jargon if at all possible, unless it is jargon that they can translate effectively. And pause. So no more than one or two sentences to allow them to interpret and then continuously check for understanding. Make sure that the person that they're translating to understands what's being said. After the session, after you've communicated with everything, if there's still time, talk with the interpreter. Make sure that you communicate it effectively. Make sure that you ask them what you can do in the future to make sure that you can communicate effectively or more effectively if needed. In your medical record, you also want to document the interpreter's name, the service used, the dates, all of their pertinent information. So you want to make sure that you're protecting yourself. And if you spoke with the client or spoke with the interpreter and promised them any follow-up materials or follow-up documents, just make sure that you're giving them those things. So informal interpreters, because that's what most of us are used to. We're used to the visit at 3 o'clock in the morning or in the middle of the day that's an emergency, and they are having their their friend or husband or spouse, or sometimes even their young children translate. Informal interpreters are great because they provide an immediate service, but there are definite downsides to informal interpreters. And the big thing is that they have no professional training. So your informal interpreters are usually going to be friends or family members or community volunteers, a neighbor who came with them, or a pastor or something like that. Another option for informal interpreters that I love is university language departments. So faculty or graduate students at a university. They are wonderful to use as last minute interpreters, especially if you call and explain the context. They will very readily put someone on the phone to assist. You can also use community cultural organizations or untrained bilingual community members. They're great because they're right there. They're usually not expensive because they just want to help, so there's no cost involved. If it's a community leader or a religious figure, it helps you establish a relationship with that community, which you need, especially if it's an emergency situation. But there's good and bad in those. And the important thing to remember with them is that if we can avoid using informal interpreters, we should. And the reason for that is that you do not know what is being said. You don't know their background. You don't know the context that they're using. Professional standards and protecting your license and your practice's reputation is that if you can use a formal interpreter and formal services and professional services, use them. If you have to use informal interpreters for whatever reason, fine. Do it cautiously and do it sparingly. And when you're doing those things, understand the risks to your practice by doing that while acknowledging that sometimes it is what it is. So, why do we care about those? So the big thing is that a lot of times, in most informal interpreters, they just want to help. They just want to communicate. They just want to make the situation better. But a lot of them lack the medical or veterinary terminology knowledge to be able to communicate effectively. And because of that, there's a potential for misinterpretation of complex information. And there can also be cultural filtering that may alter the meaning. And the big thing with that I always like to say is that if you don't speak that language, you don't know what's being said. You don't know what's being communicated. And if there are religious beliefs or cultural beliefs that are going to affect what that person thinks, you really need to have a professional interpreter there. And the best example that I can give of this is I was doing an internship with a counseling service as a survivor of rape. And I was working with a SANE nurse. And there was a woman who had been assaulted who wanted someone from the same community and ethnic background as her in the room. But she spoke Haitian Creole. I had taken 3 classes on that at school. So of course they brought me in, even though I could only say like 4 words and order food. And she had no knowledge that I spoke this language. They brought in another interpreter who was also an informal interpreter who worked at that facility. And instead of translating what the doctor and SANE nurse were attempting to say, this man began to shame her for involving other people and reporting an assault. And no one had any idea until I said something. So I tell you that horrifying story to say that you don't know what's being said. You don't know what's the context. Be very careful with informal interpreters in situations like that. Using informal interpreters, depending on what state you're in and what your practice act says, there's also potential ethical and professional risks. There's a breach of confidentiality. You're violating confidentiality. You have another person in the room that you're discussing this with. Now, in some states, not a big deal. No one cares. In other states, it's a really big deal. With those interpreters, there may also be a dual relationship that's affecting their objectivity. Can a 5-year-old really be objective when you're having a conversation with them, telling them to tell their mom that their dog is dying and needs to be euthanized? Are they going to be able to understand what you're saying in order to translate those things effectively? So because of that, there's a potential that they're going to advocate for a certain way instead of doing a neutral interpretation where they are just saying what you said. They can try to turn the conversation or persuade the conversation into a light that may benefit them or benefit the client, even if they're not doing it purposely. There may be some sort of unconscious bias there. Legally, because as managers, we always want to look at the bottom line and legality, and are we going to have to talk to PLIT or someone like that? There's liabilities with that. There's increased malpractice risk because of potential misinformation. You don't know what's being said. There's patient confidentiality violations. There's inadequate documentation of interpretation quality because you have no documentation showing that this person is qualified to be able to interpret what you're asking them to do. And they can also have challenges affecting care decisions or financial information based on informal interpretation. So, because of all of these things, we want to be really, really careful about when we're using informal interpreters and also make sure that we are never, ever using informal interpreters in forced situations. So, any complex medical procedure or surgical consent, any end of life discussions or euthanasia decisions, detailed financial discussions or payment plans, and any medication dosing instructions or critical treatments. If it is something that you cannot defend in front of the state board or an attorney, if you can't clearly say that you know exactly what was said word for word and that it was said in a way that was easily understood by that client, it is not legally defensible and you open your practice up to significant liability. So now that I said all that and scared you, what do you do if you have to use one? So if you have to use an informal interpreter, the most important thing that you need to do is verify their fluency in both languages through a structured conversation if you can. Make sure that they understand basic concepts that you're saying and have a certain comfort level with veterinary terminology or general medical terminology. Confirm that they can maintain confidentiality and document everything related to that interpretation session. The date, the time, the translator, their relationship, the qualifications that you use to determine whether or not they were qualified, whatever checklist that you use, and exactly what you told them to communicate to the client and what the results of those things were. With that, when you're working with them, just like we said before, try to talk to them in advance. Speak slowly, pause frequently for interpretation. Clear, simple language, avoid any medical jargon or anything that does not have to be a complex medical word. Don't use it. And make sure that you're verifying that the client is understanding, even if that means that you have to say the same thing 5 times or 5 different ways. Bilingual staff members, because this used to be a really big thing. And you remember practices used to pay people additional money to be able to have them in there to speak different languages. And there was a corporate practice who used to pay, I think, almost an additional $3 to $5 an hour more for clients, for staff members who spoke Spanish. The great thing about bilingual staff members is that they are immediately available. They're right there. They work for you, they work in the field. So for the most part, they're familiar with medical terminology and they understand practice procedures and that there's a potential there for cultural brokering. So they not only understand what you're trying to say, but they may also understand some cultural differences that we may not be knowledgeable about. Something to consider with them is that you have to make sure that they actually speak that language, not that they lied or had AI write their resume for them and say that they spoke Spanish because they took a Spanish class in the 7th grade 23 years ago, but that they actually speak it. Make sure that you are providing them time so that they're not in a dual role that's conflicting. So that we're not pulling them away from clinical duties to have them interpret or making things difficult for them, saying, I still need you to do all of these things that are on your schedule. I also need you to come interpret, but I'm not going to find anybody to fill that time for you. Make sure that they've had training in interpreter ethics. And most importantly, compensate them for their additional skills. We are not in the business of asking employees to do things that they're not being compensated for, especially if they are providing a service that no one else in your practice can provide. And it's a service that you really need. We need to compensate them and pay them appropriately. So if you do have bilingual staff members that you use, we need to have clearly defined roles and expectations for them. We need to schedule time for interpretation duties if possible. And I know that sounds crazy, but if you know, okay, Asusana is going to be here on a set day and time, I'm going to tell the reception staff, hey, clients get scheduled when they get scheduled, but if they need this particular language that Asusana speaks, This is the time that Azucena said that she can take away from her technician duties or whatever duties to do this. But with this, we also want to make sure that we are providing these staff members with support for maintaining language skills. So most major conferences now have different tracks that are in foreign languages, especially if they're a native Spanish speaker or if they just speak Spanish in general. Make sure that you're giving them the support that they need to keep building those skills. Or even if they're not going to a conference, make sure that you are providing them with opportunities to gain certifications and things of that nature. And the goal in those things, what I always say as a manager is that I want to do whatever I can to empower my staff members and make sure that they are all that they can be. You want to go somewhere, I will pay for you to go somewhere. You want to do a certification, I will pay for that. I want to give you all the skills that you need to be able to go anywhere and demand any money from anyone else, but keep you so happy that you don't. So if I'm asking you to perform a skill for me, I'm going to make sure that you're prepared to perform that skill effectively.
Theresa, Judy has a question, and she says, or she's asking, any suggestions on how to be sure that someone is proficient with that particular language?
If there is a university in your area, I would contact that university if they have a language department and say, hey, I have an employee who wants to serve as a translator at our practice. Do you have a professor who's willing to sit down if I buy them lunch or something like that and hold a conversation with this employee in that language? And see, just like they do when they're assessing you to see what level of Spanish course or French course or whatever you need to be in, they're going to have a conversation with them that gets progressively harder to see exactly where they are. They can also go through different translation certification programs and interpretation certification programs online, where it's just like you were taking an exam at school with a proctoring service and you just sit there and hold a conversation with someone or go back and forth reading content or translating content, and then it's reviewed by an evaluator who determines whether or not you're proficient enough in that language.
Thank you.
Mm-hmm. Okay, did I do this? I can't remember if I did this one. Okay, so to assess their proficiency, it's a perfect timing for that question. We can do formal language proficiency testing, whether that's through a third party, a professional party, or a third party at a university, an academic. We can do structured interviews in that target language. So if you have a good relationship with community leaders who speak that language, or the professors at a university, or if there is someone that you know in your area, an attorney who specializes in seeing clients in that area or anything like that, have them do the interview and have the interview be in that language. You can also do role play scenarios with them, with the evaluator, and give them specific feedback or provide them with opportunities to do certification through language testing organizations. When you're assessing them, the things that you want to focus on: comprehension of complex information, medical and veterinary terminology, speaking clarity and accuracy, because it is great that they speak that language, but if they have such a heavy accent that, yes, you speak that language, but a person who speaks that language still can't understand you, that's not very effective. But also, the big one in veterinary medicine is translation of written materials. Yes, you speak that language, but can you read that language? And if you can read that language, can you read legalese or medical terminology or veterinary terminology enough to translate effectively? Because it's one thing to be able to read a Sonic the Hedgehog comic book or something like that. It is another thing entirely to be able to translate a euthanasia consent form or a surgical consent form effectively. Another big one that we really don't think about is that we also want to assess their cultural knowledge and sensitivity to determine if there are any biases that are available. And the reason for that, the example that I always love to give is that you don't know how they feel about people from whatever culture or background that speaks that language. You don't know what's being said. So I have an uncle who was a POW in Vietnam. He speaks Vietnamese fluently, but there are also biases there because he was a POW in Vietnam. Would I ever allow him to translate something with a Vietnamese person? Absolutely not. If their animal, even if their animal was actively dying, no, because I don't trust what you're saying. I don't trust that you're saying things that are appropriate or professional, and that there are no biases there that are affecting what you're saying. So we want to assess these employees, make sure that they're proficient. And then once we are sure that they're proficient, they have everything that they need to be successful, we're going to make sure that we are continuously providing them with professional development, or CE. So cultural competency education, CE in both languages, or medical terminology workshops. If they're interested and they are a Spanish speaker, whether they're a native Spanish speaker or just learns, I learned this at AVMA that CSU has an amazing program that they're doing, a postgraduate program on Spanish in veterinary medicine. So just researching things like that, sending them to those things, or having them tell you what things they're interested in that can help them with these skills. Uh-oh, I clicked the wrong button. There we go. So in addition to interpreters, you can also use technology. So there are digital translation tools like machine translation software or medical translation apps, or automated phone systems with language options. So presione uno para español, or what have you. And the great thing about these is that they have immediate access. They have multiple languages available, and they're a lot lower cost than human interpreters, but they're not very accurate. They may miss cultural nuances, or different words that have different meanings in different cultures or different countries that all speak the same languages. And because of that, they have a limited ability to clarify things or provide context. They're also very frustrating, or at least for me, because I'm the person who halfway through the automated system starts screaming, representative, representative, over and over again. So if in a difficult situation, you may not want to use these. They're available, but just if you're going to be more frustrated by them, they may not be the best option. So there are also some great translation tools and apps that you can use. So the most popular one is going to be Google Translate, Microsoft Translator. Canopy Speaks has a medical focus, and that's one that's pretty common in emergency medical services. And Medibabble, which does medical phrases. When you're using apps to communicate with these clients, the best practices is that you use them for basic communication only. And all you're doing with them is, after you use them, verify understanding through teachback. So ask the client to tell you what was just said, and try to combine them with visual aids whenever possible. But be aware that it's an app, it's a machine, it is not picking up in nuances, it's not picking up in language pronunciation. There are a lot of things that it can miss, just like someone using speech to text. I am the queen of speech to text, and anyone who is Facebook friends with me can tell you that when I use speech to text, you never know what's coming out of my mouth, especially given my Southern accent. And depending on how they're speaking to the app, to give you an example, in Google Translate, my son Brennan's name is Brandon, Braden, Bronston, like 15 different things. So because they're using artificial intelligence, there is a layer there that has the potential for errors. So just keep that in mind if you're going to use them. They're great when they're needed, but they should not be relied upon. So when you're communicating with clients with limited English proficiency, you also need to make sure that you are using appropriate nonverbal communication as well. So with that, welcoming body language and facial expressions. Don't be like me with my resting bee face. Make sure that you're making eye contact when and if appropriate. So consider any cultural variations, especially variations with communities where males and females may have different standings. Make sure that you're being appropriate with those clients. Use a slower speech rate for clearer articulation, because they do speak English. Their English is just limited. So if you slow things down, especially if you have a Southern accent like me, oftentimes they can understand what you're saying a little bit better. And with that, pay attention to the client's nonverbal cues. Are they leaning forward? Are they engaged? Are they showing signs of frustration? Are they folding their arms? Are they sitting back in the chair? Is their body language open? Or are they clearly showing signs of shutting down or becoming distracted? If at all possible, in addition to your physical nonverbal communication, do whatever you can to make your hospital a welcoming environment for them. So multilingual welcome signs. If you know that that client is coming in, greeting them with a greeting that is in their native language whenever possible. Even if you completely butcher it and mess it up. Just the thought of you caring enough to actively try to greet them in that language makes a considerable difference. So use international symbols in common areas. Have clear wayfinding pathways regardless of languages. So in common areas, a sign that says welcome or exit, have it in multiple languages if possible. And make sure that you have representations of all of your clients in your practice materials. So I always liken that to I used to work at a facility and I was like, I noticed that you never see me in any pictures or videos on the website until it's some sort of like Black History Month or something like that. We don't want to do that. We want to make sure that if we have those clients in our practice, if we have pictures of clients on websites, we want to represent our entire client population. Not that we're tokenizing anybody, but we want to have the full scope of our practice there. We want to make sure that they see that they're valued and appreciated and welcome in our practice. Another thing that we can do is use visual aids and universal design for learning. So with visual aids, when you're communicating things, make sure that you have models, anatomic models and diagrams. Try to do medication schedules in addition to just the pill vial and the discharge summaries. Clearly have a picture of what that medication looks like on a chart or a calendar. And those things aren't just reserved for when you have clients with limited English proficiency. If you're sending somebody home with 15 medications, if their dog just had major orthopedic surgery or neurosurgery or something like that, and you're sending them with a bunch of medications, it takes 5 minutes to make a calendar in Microsoft Word. Make sure that you have, if possible, videos demonstrating home care techniques. If you have tech students in your practice, that is a great thing for them to do. Hey, for pharmacology, make me a video discussing this. Make me a video showing how to give sub-Q fluids or an injection or what have you. The big thing with this is that we want to follow principles of universal design for learning. We want everything to be accessible for people, regardless of their language or experience. Our designs need to be simple and consistent, and we need to have multiple modes of presenting information. So if we need to tell owners how they need to give a prescription, I have my calendar, I have the discharge summary with it in paragraph form, I also have the bottle. And in that being said, we also need to know that there are still going to be errors, there's still going to be things, there's still may be misunderstandings in what we say. That's okay. So in creating materials or adapting things that you have, make sure that you're using clear, simple illustrations, limited text with basic vocabulary, use the same symbols and icons all the time, and make sure that you are being culturally sensitive in any images that you use. We're almost done, guys, I promise. So how do we get started with all this? So if you're in a general practice, focus on the most common conditions and procedures that you do. Start building your resources for preventative care and develop relationships with the community and adapt your communication to different cultural styles. If you're at an ER, so emergency facilities, make sure that you have phone numbers available for telephone interpreters, have visual communication tools for triage if needed, have multilingual consent forms, especially that informed consent or consent to stabilize, or more importantly, a euthanasia consent form. Make sure that you understand cultural variations in expressing pain or distress. And to give you an example of this, I read something recently where there was a woman who was put on a psych hold because she went to a hospital facility or something, and a doctor saw that she kept doing this while she was talking to them, and they're like, okay, this woman is self-harming and doing this and doing that. Well, as an African-American woman with braids, she can't scratch because it'll mess up the braids, so when her hair was itching, she had to do that. Make sure that you are cognizant of anything like that can affect the way that clients are expressing pain or sensitivity or frustration, or the way that they're discussing what's going on with their pet with you. And depending on the culture, make sure that you're aware that there may be some family involvement in decision making. In specialty practices, unfortunately, you need to have everything. So if you're at a specialty facility, you need to have comprehensive materials for any complex procedures that you're doing. You need to have detailed multilingual informed consent forms for every language spoken in your community or within your referral area. You need to have instructions in the preferred languages of those clients because we really want to focus on building trust for long-term specialized care. We want our RDVMs to be told what a tremendous experience that their clients had with us, how they felt safe, how they felt welcome, all those different things. And in doing that, not only are you building that relationship with that client is telling their friends, the RDVM is telling other people, the RDVM will send to you before they send to other people. So, cultural competency beyond language. So culture affects everything and influences everything. It influences human animal relationships. It influences our views on medical intervention and how far is too far, and end of life decisions and financial priorities for pets, as well as any expectations of the veterinary client relationship. And there are a lot of different cultural factors that can also affect the way that we're communicating with clients. So it's whether culturally they have direct or indirect communication styles, whether decisions are individual decisions or family-based, attitudes towards preventative care, and their comfort with questioning authority figures. Because as a veterinary professional, depending on the culture, you are considered an authority figure. And all of these things, the biggest one for me is the cultural perspective on animals. And to give you an example of this, I had, when I was a little girl, a family friend was looking after our pets while we were out of town, and our dog got sick. And she took the dog to the vet. She didn't want to touch the dog, she didn't want to do anything with the dog. And the veterinarian was so upset with her and just so outraged. And when my mom got back into town, she ended up leaving the dog at the vet. And when my mom got back into town, the vet told my mom, oh, she was terrible. She was this, she was that. You should never leave your pet with them. And my mom pretty much ripped this doctor a new one. And it's like, okay, but this is also a woman who grew up in Louisiana during the civil rights movement, who is terrified of dogs, but she still agreed to watch our dogs so that we could go on vacation, or not vacation. I think we were going to a funeral or something like that. She agreed to watch our dogs, even though she was terrified of dogs. She went to school with Ruby Bridges, and as a young child, had police dogs attack her because she wanted to go to school. But she still cared enough to notice that there was something wrong with the dog, pick the dog up, take the dog to the vet, pay for the vet visit, and provide appropriate care within her comfort of doing those things. So I'm telling you that story to say that there are different cultural perspectives on animals and variations in human-animal relationships. Whether it's something like that, where it's trauma-centered or trauma-focused responses, or whether in that culture they're viewed as working or companion animals, whether there are any religious or spiritual beliefs associated with that species, or cultural considerations, and whether this is a family member versus property. And all of those things can have an impact on treatment intensity preferences. How far are they going to go? How much are they going to spend? Are they going to euthanize? Do they believe in euthanasia? Are there other things that they want to do? Do they want to provide palliative care and make that animal comfort until the end, where it's a natural end? And are they going to be compliant with recommendations? And in addressing these things with clients, we need to make sure that we are approaching any differences or different perspectives with cultural humility. We're going to avoid making assumptions. We're not going to do like the doctor did, who just thought, oh, my aunt, not my aunt, my family friend just doesn't want to be around this dog. She, like, no. Why doesn't this person want to touch this dog? Why doesn't this person want to be in the same room with them? We're going to ask open-ended questions and allow for them to respond. We're going to respect diverse perspectives and create an environment of psychological safety with the goal of finding common ground and providing for the welfare of that animal. So, okay, I feel like we just went through this one, so I'm just going to skip it, but the slide is there if you want it. So we also need to make sure that we are building cultural competence. So we want to make sure that in thinking of cultural competency, that's just making sure that we have knowledge of different cultural practices and self-awareness of our own cultural biases, because we all have implicit or unconscious biases that we're not aware of. So we can't necessarily get rid of those without effort, but we want to know that they're there. We want to be cognizant of them so that we can address them and use whatever skills we have available to adapt our communication and care in order to make sure that everyone in our practice, especially these clients, is comfortable, they feel safe, they feel like we have their best interest at heart, because we do, and that we are going to provide the best care possible for them and their pets. So with that, we want to, no matter what, have an attitude of respect, curiosity, and appreciation. To do that, there are options out there where we can do formal training and education. We can learn about different cultural groups in our areas and build relationships with those communities, but also seek feedback on cross-cultural interactions. With that, we need to recognize that there are some limits to cultural knowledge and make sure that we are approaching each client as an individual. Yes, you are from this marginalized group or this background or speak this language. You are still an individual person. And while I have knowledge of that group, things related to that group do not define you. And I'm going to do whatever I can using the knowledge that I have of that group and of you as a person to provide appropriate care for you and your pet. So in doing that, we want to make sure that we're creating a welcoming environment for all of these clients. So multilingual signage and materials, diverse representation in educational materials, comfortable spaces for family discussions, especially difficult ones, and culturally appropriate symbols and artwork when actually appropriate. We want to make sure that our staff has the training and attitudes necessary to be able to work with these clients. We want to make sure that they're greeting clients respectfully and correctly, and they are pronouncing names correctly. We're not giving people nicknames. We're not purposely mispronouncing names. We are saying that name over and over and over again. And if we stumble through it 50 million times, as long as we are actively trying to say it, it's okay. Because you're trying, you are making an effort. We're going to avoid any stereotypes or biases or assuming things about people. And we're going to recognize that we all have those biases and we need to address them. And we're going to have patience with communication challenges. So we've gone through all of this. We have our plan. We know what our practice is like. We know what our issues are. Now we need to actually come up with a language access plan. So for that, the key elements of our access plan is going to be a language needs assessment. So knowing what we need, knowing who we're going to have do what, so staff roles and responsibilities, how we're going to provide interpretation services, and what the protocol will be for those things. We're going to start the process of translating any relevant written materials, start training our staff, and collecting and evaluating data of how effective our plan has been, what are some issues that we're having, what were some issues that we saw before, and what have we done to improve things. But we're also going to make sure, because we can say that we're going to do all of these things, we have to allocate budget and resources for these things. If we're giving staff members additional duties, we have to allocate time for them to do those things, even if it means that we're shuffling things or moving things around. We're doing whatever we need to do and truly investing in these plans for them to be effective. So in training staff members, we're going to make sure that we are looking at legal and ethical requirements, working effectively with interpreters, using translation tools appropriately, and knowing what tools to use and what not to use, and the limitations of those tools. We're making sure that we have done cultural awareness and sensitivity training and documenting language assistance. So if they are using these interpretive services, we're documenting that. If they're going through different trainings, we're documenting those trainings that the staff members have had, and also using those things when it comes time for annual evaluations and merit increases or things of that nature. When training them, we're going to make sure that we're doing orientation for all staff members. We're also going to do role-specific training and hands-on training with scenarios when appropriate, and do refresher training and provide just-in-time resources when relevant. So, but we can't just do training without making sure that the training is effective. So in pure teacher form, we can do pre and post knowledge assessments. We can observe their interactions with those clients. We can have staff give us feedback and tell us how their confidence has changed or improved or even decreased in working with those clients with the language resources that we've given them. But most importantly, we can look at client satisfaction with the language services. Have your clients noticed a difference? So in making those materials, we want to try and streamline what we're doing. And the best way to eat an elephant is with itty bitty bites. So we need to make sure that we're creating multilingual materials. So the documents that you're going to prioritize for your language access plan, your informed consent, discharge instructions for common procedures, medication administration guides, post-surgical care instructions or discharge instructions, and preventative care recommendations. Most of the major preventative providers, if you reach out to them and tell them that you have a particular language that you need documents in, they will readily provide you with those documents, usually at absolutely no fee. They usually already have them available. When we're using translation services, we're going to use professional translators for medical content whenever possible. We're going to have them reviewed by bilingual veterinary professionals and test materials with our target language speakers and regularly update those things as medical advances are being made. And if at all possible, provide templates for efficiency. So, highest priority documents to translate before you do anything else: euthanasia consent forms, emergency care instructions, anesthesia and surgery consent forms, financial policies and estimates, because you can't do any of this if you're not getting paid. And if a client doesn't know what they're signing, it is not legally defensible. You will not get your money. And any client intake or registration forms. Second tier priorities, things that you can focus on after you have the primary ones: any preventative care guidelines, common disease information sheets. And I want to say that VIN and AHA possibly have these things already in common languages. Any medication instructions for frequently prescribed meds, any behavioral recommendations, or nutritional or weight management guidance as well. When you're using translators, to find them, we're going to use professional translation agencies or certified translators. I'm the big one on free labor working at a university. Contact those university departments. They'll usually give grad students extra credit to help you. When you're working with them, give them context and the purpose, and give them a glossary or document saying the most common terms. Give them time to be able to do quality work. Budget for them reviewing things and doing back translations, and plan for updates. Have clear documentation that they are appropriate to translate things. Just because it's your first language doesn't mean that you can translate it. As a teacher, I can tell you that there are many people whose first language is English, and if you ask them to write you a paper, good Lord, they're using the letter U instead of the word YOU. So make sure that they know enough of that language to be able to provide a professional translation. And you also need to be able to translate it back to the original document. Get it reviewed by a second translator if possible. Test it with a field audience, or reach out to a representative from that community and say, can you review this document? Can you tell me if this document makes any sense? Does it have grammatical errors or issues with things like that? Have it reviewed by a bilingual veterinary professional if possible. And document your quality control process for risk management. That way, if there is an issue, if there is a problem with that form, it won't be as bad because you clearly showed all of the different ways that you tried to verify that things were accurate. How do we do that? So start with to-phone interpretation. That's a little spelling error for y'all in case y'all need to laugh. Focus on the top 1 or 2 languages in your community. Translate 5 documents. Just start with 5. Use visual aids for common procedures and network with community resources. If you're a larger practice, make this someone's job. Make this an extra duty. So make a designated language access coordinator. Contract with in-person interpreters. So if you know that there's someone in your community or at a university, a graduate student in a language program or something like that, hire them. Hire them as a 1099 or a W-2 employee that is PRN or contingent. Pay them for an hour when you need them, even if it's only for 15 minutes. Make sure that you have a comprehensive set of translated materials and do regular staff training. If you're a larger specialty practice, once again, guys, y'all are getting the short end of the stick, which is wonderful because you have the resources to do this. Have formal language access teams or access leaders. Have on-site interpreters whenever possible for common languages, and have a complete multilingual materials library for everything that you are doing at your facility. So some essential tools that you can have just to start: you can order I Speak cards showing different languages, and I'm sure you've seen them at a human facility, a little card that sits on a desk that has I speak such and such in 50 million different languages. Just have that there. And when you have someone come in and you don't understand what they're saying, show them the card and just have them point out their language and go from there. Use language ID apps. If you're using an EMR or a PMS, have an alert that pops up that says that that client's first language is whatever. So as soon as that client calls, you can know, okay, Mrs. Wynn or Miss Rivera wants to come in. I need to have someone here that speaks that language at such and such time, or I need to have the translator ready to go when she gets here. Use interpreter services. So on this slide is a list of a number of different interpretation services that can be used. Use local healthcare interpreter services or associations when available. And you can also use different video remote services as well. So I just said a lot to you. I know it's a lot. The big thing that you want to focus on, start with concrete steps. The first thing you can do to get started, that first little bitty bite, add a language preference to your client registration forms. Find out who speaks what at your practice. Because I've been with my current position for a year now. And before that, I was at a practice for 11 years. And no one at either one of those practices knew that I speak enough Spanish to have served as an interpreter and translator at a law firm. No one knew because no one asked. Instead, they tracked down different people to do those services when I was there because they didn't ask. And I never found out until after the fact that they needed those things. So find out now so that it's less of a headache. Research interpreter services in your area. Make visual aids for the most common procedures. Pick one or two important documents and get them translated. The average cost of a translation is just going to be whatever that attorney or interpreter makes in an hour. And you'd be surprised how quickly they can translate documents. And train your staff on basic cross-cultural communication. So do whatever you can with just little bitty baby steps in order to start your language access plan. Any questions for me?
Awesome. Judy, you had put a link to something in the chat. Can you say what that link was for? I couldn't tell.
Yeah, it is for these YouTube videos by a company called Vepacito. And they're actual videos that are in Spanish where you can just you'll have to take a look at them. They actually uh go over things like ear cleaning and stuff like that.
Awesome. So it's veterinary.
It's all veterinary. Vetpacito.
Perfect. Thank you.
You're welcome.
Any other questions for me?
No, there were a lot of people like the talk, and I had mentioned I work with an emergency hospital who has forms in 3 different languages because there's 3 different predominant languages in the area. So I definitely love that information you gave. Thank you so much. It was absolutely beneficial for like stuff I didn't even think about. Like even asking your team, as a recruiter, I get a lot of people who tell me they speak a different language and it's on their resume and stuff. And I try to put it in my summary to the hospital, but what they do with it next, I don't have any idea. So that's actually a great thing to have on your like work employee form that you fill out. You know what I mean? Like just have them fill out what they speak. That's amazing. It's a silly, great idea.
And or once you have hired them, so there's not any risk of potential discrimination, but it makes such a big difference. And just knowing that, like I said, all of those situations that I experienced, I was there. I spoke enough Spanish to do medical translations. No one ever asked. And I never knew until after the fact. And they're contacting, if there's not a doctor or someone there, they are calling and paying facilities to do translations that I could have done. But you don't know if you don't ask.
Yeah, no, that's awesome. Thank you for that. Julianne also said, thank you for the presentation. It's been very helpful.
Thank you.
All right, awesome. Well, thank you guys today for coming. I put it in the chat, but I will be sending CE certificates to everybody who attended live today. And if you're watching this later on YouTube, thank you for watching it later. For those of you who came live, thank you for being able to come live. Teresa, thank you so much for giving this presentation. I really, really loved it. So I appreciate your time, the energy doing this for me and for all my attendees and things. So thank you very much. So I hope everyone has a great rest of their day. I'm going to go ahead and stop the recording.